Well, good evening, everyone. My name is Paul Bucky.
Oh, look at you. Good evening. This is Bev.
Bev Wood, yes,
Bev
sirree.
Wood.
And we have a special guest for our Irritable Bowel Syndrome workshop today, Dr. M. Welcome.
Hello, good evening.
Yes,
Good
good to have you
evening.
with us. We are excited that you came on to share with us your knowledge. Dr. M's a naturopathic medicine doctor here in Tucson, Arizona. So we're all right here together in the lovely little Pueblo. And
Nice.
we're just going to let you start. Take it away. If you have any questions, let us know and we'll pass them on to Dr. M. So it's your show.
Okay, great. Thank you so much for having me tonight. I am very excited to talk about gut health. It's definitely one of my favorite topics as a naturopath and probably a favorite topic of many naturopaths. So, the first question is, what is irritable bowel syndrome? The official diagnosis for IBS is chronic abdominal pain and altered bowel habits in the absence of an organic cause, which, in my opinion, is a very broad definition, which still leaves many people wondering what is IBS? Because that definition really means you have abdominal pain and you have something going on in your bowels, but we don't know why. Irritable bowel syndrome, for those of you not familiar or not very familiar with your digestive tract, is affecting the lower GI tract. So this is your colon and your rectum. So these are the portions of your GI tract right before you exit the body. So it's important to say that irritable bowel syndrome is not a disease, rather an umbrella term for many different digestive symptoms. So this can include constipation, diarrhea, bloating, gas, abdominal pain, fatigue, mucus, undigested food in your stool. It encompasses many things, which makes it the most commonly diagnosed GI condition in America and is now the second leading cause for people missing work. I think it's a very important topic in GI health because it is, again, an umbrella term. So many people go into their doctor with GI complaints and they leave with the idea of having irritable bowel syndrome, but no real solution or understanding of what that actually means or what they can do to help. Irritable bowel syndrome is statistically more common in females than males. So that's kind of unusual in many different presentations. Officially, IBS has 4 different types. In the definition, you can have IBS-C, which stands for constipation. This means that you're presenting with more than 25% of your stools being hard or lumpy, difficult to pass. There's also IBS-D, which stands for diarrhea. So you can guess that means more than 25% of your stools are loose or more watery. And then there's IBS-M, which stands for mixed presentation, which means 50-50 in terms of loose stools and constipation or hard stools. And then they have IBS-U, which is kind of unknown, meaning there's insufficient amount of consistency in having diarrhea or constipation. So again, very much a blanket to cover any kind of presentation with justification. It is also a condition that does not require any official lab diagnosing to say that you have or do not have IBS. It's a diagnosis given by clinical reporting by the patient and the interpretation of the doctor. So from a textbook definition, in order to receive an ICD-10 code or what your insurance is looking at per se for payment, you have to have recurrent abdominal pain for 1 day a week for 3 months consecutively, with the addition of either change in stool frequency, meaning having more stools than normal in a day. So if you may have always had one stool, now you're having 3, 4, 5 stools, or a change in the form or appearance of your stool. So that goes back to the hard, lumpy, soft, watery, seeing mucus, or undigested food in your stool. So those criteria that I just mentioned need to be present for 3 months consecutively in order to receive a diagnosis of IBS. So again, there is no blood test that you can ask your doctor for that will give you a positive or a negative official you have IBS or you don't, which I think also allows for many people to receive the diagnosis out of, for lack of better terms, maybe convenience, not knowing why you have something, but allowing you to have a diagnosis.
So we do have a question based on
Okay.
what you're just saying. Why is it so painful?
So it is painful because a lot of the change in your bowels has to do with the motility. So in the digestive tract, there's different muscular layers that make the intestinal lining. And when you have IBS, or that, in a real sense, irritable bowel, your bowel is irritated at you, it oftentimes is contracting when you don't have food in it, or over contracting when it's trying to push food down the digestive tract to be excreted from the body. So it is the same in essence as having a cramp in your leg or a Charlie horse, but this is in your intestines. Does that make sense? So the other thing that oftentimes gets talked about in the IBS conversation is IBD. I don't know if anybody here has heard of IBD, which is inflammatory bowel disease. And then IBS is inflammatory bowel syndrome. So many people do use them interchangeably, but they are different. IBD is a disease, chronic digestive disease, and a bit more serious. So we know IBD can have long-term health effects for people. It can put you at a higher risk for colon cancer. It presents with higher levels of inflammation in the gut, which can damage the tissue long term. And then IBD is where different conditions like Crohn's or ulcerative colitis fall under that category. And those are official diagnoses that can be made from different testing, like a colonoscopy, for example. So while they sound very similar, they are very different. IBD is very clearly defined. IBS is just a kind of an umbrella to talk about many different symptoms. So I believe there's a picture or a slide PDF that has just a picture of some of the symptoms that many people experience when they're coming into their doctor's office. So we talked about, I think it's in the upper left-hand corner, there's a girl kind of hunched over with abdominal cramping or abdominal pain. I do usually say cramping because IBS doesn't usually present with like a sharp stinging pain. It is more that muscular contraction cramping. There's a lady sitting on the toilet. So again, definitely changes in your bowel habits, either being constipated, having diarrhea, too many stools. The reason why a lot of people miss work is not so much that the constipation is such a bother, it's that they're always feeling like they have to go to the bathroom. So they don't want to be at their office maybe and having to go to the bathroom every 5 minutes. So a little bit embarrassing for many people. And then gas, bloating, and fatigue is also a huge symptom for IBS, but many people are fatigued in general. I brought up the different symptoms because each one of these symptoms from a naturopathic point of view would warrant further investigation. Because as naturopaths, we're always trying to figure out the root cause. Like, why do you have abdominal pain? Why are you bloated? What's going on that is making you gassy? And so we welcome lots of people who have IBS because it gives us an opportunity to really educate people about what some of the causes are for these symptoms. And then once we find that cause, then we can really help people heal and understand their disease or understand what's going on in their body and present them with options to heal. Again, this is one of my favorite things to talk about. So I'm going to go into the naturopathic world of IBS. So the next slide that I had for you all was the treatment option. So in the upper right-hand corner, there's a picture of the colon. I think it's in teal and red. So if you were to come to a naturopath and talk about having IBS, the first thing we're going to do is just talk a lot about your history, because we really need to understand what's going on in your GI tract, and that includes a deep dive into what is going on in your microbiome. And your microbiome is all the little critters, good and bad, that live along your digestive tract. And really, your digestive tract starts in your mouth. You have a certain microbiome that surrounds your gums and your teeth, and then down your esophagus, into your stomach, into the small intestine, and then down into the colon and out into the rectum. So with IBS, we're really trying to figure out what's going on in your microbiome that's going to cause a lot of those symptoms. So when we talk about underlying causes for some of those symptoms, one of our first exploration topics might be antibiotic use. So antibiotics are really good at killing things, right? If you have a bacterial infection, you're going to go on an antibiotic oftentimes. But what they are not good at is being selective. So if you take an antibiotic, it's going to go through and wipe out the bad bacteria or something that's not supposed to be in your body, but it oftentimes takes a lot of good bacteria with it. And so one round of antibiotics might not be a big issue, but if you've had multiple rounds of antibiotics in a small amount of time, or if as a child you had reoccurring strep throat and you were put on antibiotics quite often, then we've compromised the integrity of your microbiome. And that leads people to be susceptible to different GI issues like gas, bloating, constipation, diarrhea, because each microbe in our body has a specific purpose and a specific real estate that it needs to live in. So we don't want microbes that are supposed to be living in our small intestine to be down in our colon. And we don't want bacteria that's supposed to be in our colon up in our small intestine, because then it can't do the right function at the right time. So oftentimes in the talk of IBS, we're looking at things like SIBO, which is a whole nother topic on its own, but it's small intestinal bacteria overgrowth, which basically just means that microbes that should be living not in your small intestine are now in your small intestine, oftentimes overgrowing from the colon up the digestive tract. And then those microbes that live in your colon, they're responsible for digesting more, maybe like fiber, but now they're up in the small intestine, so they're breaking down fiber earlier than it's supposed to, or compromising the digestion of your fats. And so then you start to see these differences in your stool and in your symptoms, because the food is either sitting too long in the GI tract or getting broken down too quickly. The other things that we talk about with the microbiome are infections. So fungal infections, a very popular one most people have heard of is Candida. What does Candida do to your microbiome? Parasites and bacterial infections. So parasites can be things like ringworm or flukes, but also bacterial infections like E. coli, which we need in our stool, but only in a certain amount, which is also similar for bacterial strains like C. diff. If you have a C. diff infection, that is a major health concern. But what a lot of people don't realizes that C. diff is essential in different parts of your microbiome for us to have a healthy, robust immune system. So a lot of gut health is about balance. The other things that those parasites or bacteria can cause is leaky gut. It's kind of like another, buzz topic in GI health is leaky gut, which basically means from having bacterial infections or not having the right microbiome, the junctions that were very tight and kept food and particles going down the GI tract now are damaged. So the fence or maybe the blocks keeping things in are now separated, which allows food or downstream inflammation to exit the GI tract and go into circulation, which leaves people feeling inflamed. You might have body aches. You might look like you're having allergies to foods that maybe you ate your whole life. So that brings us also to the topic of food sensitivities. Many people have IBS-like symptoms because they're eating foods that don't agree with them. A food sensitivity is not a food allergy, so it's not the same of if you're allergic to shrimp and you eat shrimp, you might have an anaphylactic reaction, like a swelling of your lips or your throat swelling closed, or you might just get itchy, have a rash. But a food sensitivity is more of a delayed reaction, meaning you might eat shrimp and you don't notice anything till an hour later. You have like you're tired, or you get maybe a little bit of an itch in your throat, but it's after the fact. So you don't always think about it. Well, I didn't eat anything different than normal. But as the integrity of your microbiome changes because of different issues, you become more susceptible to those food sensitivities. And then also along the GI tract, you can't miss the liver and the gallbladder and the importance they serve. So your liver has many jobs for the body, but in terms of GI health, we think a lot about bile acid. So the liver makes bile, stores it in your gallbladder, and then releases it into the GI tract to help you break down fats, especially. So if you have any kind of compromised liver function, or gallbladder function, that can also affect your GI and your digestion and can lead to symptoms that then can be leading to IBS. So those are kind of the gamut of GI things that we would want to explore as naturopaths.
Dr. M, so that somebody just said the question is, can other GI conditions display as IBS or IBD? So is that what you're saying here?
Yes. So that's why I tend to really think of IBS as just an umbrella that's hovering over all of those symptoms. So you could have SIBO, really, but you've been told you have IBS. Or you might have leaky gut and nobody knows really what to do about that. So they said, oh, you have IBS. And in an allopathic world, if you have IBS, your options are very limited. You might be put on something like Lamodal, which is a medication to just stop you from having diarrhea, but it doesn't actually do anything to address why you have diarrhea. Or you might be put on antidepressants because when you have compromised gut function, you're not absorbing minerals. If you're missing a lot of work or you're having issues in the bathroom, you're not going to want to go out maybe with your friends, and you start to present as being depressed. And then the easy thing is to give out an antidepressant and tell people to just start that and move on instead of really looking for the root cause, which is a good segue into mental health, and gut health are very closely related. Was there another question?
Well, yeah, before we go on to that brain part of it, somebody wanted to, so you talked about liver, gallbladder, they wanted to know, is this ever related to a kidney problem?
Yes, not as often. So kidneys would play a role here, I think, with hydration levels and the ability to manage electrolyte balancing, because constipation or diarrhea can have a effect on your hydration levels. So we don't think of the kidneys so much as being forefront in terms of our gut health, but they definitely are important and do play a role in general. Could you clarify what CTI is in that abbreviation? Okay. All right. So with the brain, the other part, I think that is a true blessing when you see a naturopath, although I know I'm sure I'm biased to some degree, is that we are also always looking at you as a whole person. So mental health or spiritual health always plays a part in your physical health. And this has also been, shown in clinical studies. Your brain and your neurotransmitters directly affect your gut motility. So I always break this down to the easiest example is when we're kids and we're nervous, the most common thing that we display is having a stomach ache. And that just shows, your brain is thinking, I'm nervous. You're excreting different chemicals, different neurotransmitters. Serotonin receptors especially play a large role in the gut. And so if we're feeling anxious, then oftentimes we're firing too much in the gut too, and you're getting diarrhea. So sometimes people are like, I've got a stomach ache. I have to go to the bathroom. Or sometimes, if you're about to give a presentation and you have stage fright, like maybe you're like, oh my gosh, I have to go to the bathroom. And you're like, but you don't. It's just the signals from the brain from the anxiety. So that also just relates to stress. The world that we live in is very stressful for a multitude of reasons. And sometimes the best thing we can do to help people who have GI issues is also just taking the time to talk about stress and what is going on in the person's life and how can we help them manage or cope with the stress. So that is giving them tools in their toolbox to help manage what's going on a day-to-day basis. Because even in the naturopathic world, if I find out that you're missing a very key probiotic strain, I could give you all the probiotics in the world, but if we don't help you manage stress, then we're never really going to get you back to being 100%. And I do say manage stress because it's impossible to really get rid of stress. I always joke if I could get rid of people's stress, I'd be the most popular doctor in the entire world. What a wonderful thing. But it's just very important to bring that up because so many people just get a large amount of relief from IBS-like symptoms or IBS, IBD even, from learning to be more mindful about how what they're thinking, what they're doing each day affects their physiology. So that's very key in that in this conversation. I think on that slide, there's also, exercise, hydration, getting movement in, staying hydrated, especially here in the desert, is very important. And then movement, that doesn't mean you need to be running a marathon, but just moving your body. A lot of us have desk jobs or you're in front of the computer a lot. So making sure that you're moving because movement helps your bowels move. And then I think a lot of people kind of ask you, well, that's really overwhelming, everything you just said. Like, how do we know where to start? Like, what? I'm going to come in and tell you everything, and then you're just going to know magically where to start, which maybe sometimes happens. But we do have testing options for gut issues. They're not what you're going to see in the typical allopathic office, but we do a lot of stool testing in my office, and we call it comprehensive stool analysis, which means we're looking at your stool or your poop for what is your microbiome composition. We can tell so much from somebody's stool. We can see inflammation markers along the gut. We can see your pancreatic function. We can look at biomarkers. We can see, do you have fat in your stool? Do you have food in your stool? And we can also break down now, the strain by strain in your microbiome. What do we see? What are you missing? And this does help us really create a targeted treatment plan for people. And I think that's a peace of mind. And also, I'm sure many people know supplements are not cheap either. So, it helps people know that what they are ingesting is what they actually need. Those stool tests also can tell us if you have parasites or candida, things like that. We can also test for food allergies. We can do breath tests for SIBO. And then we always take a look at blood work to see, what are your inflammatory markers in the blood? What kind of vitamin deficiencies might you have? And what is the integrity of your immune system like? So it is, while IBS is a gut issue, it is a full body issue. So we need to look at the different symptoms in many different angles.
Wow.
To really help people heal and understand. And I think, without saying it, I probably circled around this topic, but diet obviously is also very key. Learning to eat properly, the right intervals, the right foods, so that you are getting all of the nutrients you need, all the fiber you need, healthy fats and things like that.
Wow.
I think that's it.
Yeah. We have just a couple of questions, and we're going to go teach BioTouch, which research shows reduces stress. But we have a question. So the CTI was actually a UTI. Can this be related to UTIs at all?
It can. So in females, there is also many women will complain of different hormonal changes or like changes with their period, but your vaginal tissue has its own microbiome. So if you are having issues with stool, or if maybe you're not wiping properly, you can introduce the wrong microbes to the wrong area, which can then lead you to be susceptible for UTI.
And then the final question we had was, can polyps have any effect on IBS?
So I would say that polyps generally develop after you may have had other longstanding IBS symptoms, because sometimes polyps form after bouts of constipation from the straining. Sometimes, though, polyps do cause an obstruction, which also affects constipation. So I would say they definitely are related. A lot of that would be chicken or the egg. What came first, the polyp or that?
Wow. Dr. M, that was awesome. It was great to have the interaction. We had a lot of people questions. You're a good presenter. You're clear. You have sort of a dance to your presentation. I like it.
I learned a lot. Thank you. Yeah.
So, if there are no other questions, we really appreciate Dr. M being with us, naturopathic doctor at Transformational Medicine here in Tucson, and we look forward to having you on again.
Okay, sounds good. I look forward to it as well.
Yep.
Thank you.
Thank you. Take care.
Thank you, Dr. M.
Hi, good night.
Good night.
All right. Whew. Overload. That was great. Yeah, that was. I just learned a lot about where to even work, where to do BioTouch. I love these workshops.
Every time she mentions something, I went, "Oh, that's it. Yep, well, you're going to teach that. Oh, there's that set. We're going to teach that." We're getting pretty good too.
Yeah, we are. So, Dr. M, thank you much. We're just going to move right into, because we have a few sets to do. If you haven't downloaded the workbook yet, justtouch.com/workbook. And we're going to have Bev teach us the sets of points. And for those who've never done BioTouch, she'll give you a little intro. What is BioTouch?
Is BioTouch. Okay. So just quickly to go over the workbook, if you have access to it or download it, we notice that first page is always about the condition itself. And oh, I see that I've got a SYM syndrome. So excuse that, we will change that. Irritable bowel syndrome. Anyway, we have that first page. It's just a overview of the condition. We always like to just kind of give that prior to the presentation, so you always have something to refer back to. So that's that very first page and some information about the foundation, the bottom. So let's jump right into this. What is BioTouch? We always like to go over these 4 points just to, for those of you who are new, have not been on any of our health condition workshops, just to kind of introduce you a little bit to BioTouch and what it basically is. And also those of you who tune in quite a bit, it doesn't hurt us to just review a little bit. So basically BioTouch is a very simple, we say simple, it's a hands-on healing technique, and it uses the 2 fingers of each hand to lightly touch on the skin. So touching very lightly like a butterfly, as we say. That's basically what's happening. It's touching on the skin. So the definition of BioTouch is one person touching another person lightly on the skin. And of course, we, in this society of get fast results, I do it on myself. We always get the question, can you do it on yourself? And our pat answer is, well, if you can reach those particular points on your body, there is nothing to say that you cannot do that. By definition, though, you are not practicing BioTouch. So yes, of course, you can touch those points if you can reach them. But BioTouch is a relationship, as we'll find out, and it brings 2 people together to share practicing being with each other. It's a relationship. So let's begin with the first bullet. BioTouch is easy to learn. And yes, even children have learned it and can practice it effectively. In fact, we have had children get certified. So it's we have our classes and our trainings and workshops that anyone can attend and learn BioTouch very quickly and begin to practice. BioTouch is a complement to any healthcare program. It enhances everything. BioTouch enhances everything. The last couple of years, we have realized this wholeness that even Dr. M was talking about, the wholeness of balance in the body, that BioTouch is a holistic system and integrative. So it is very effective, whatever healthcare program you are working with, whether it's a diet, pharmaceuticals, if you're on particular prescriptions, working with your doctor. We always encourage everyone to please work with your healthcare provider, whatever that is. Any other modality that you are doing, BioTouch just integrates with everything and really enhances that experience. The next bullet, BioTouch has no levels of ability, and everyone is effective the first time they touch. And yes, it's true. I know it sounds kind of strange. The only thing that you need to have to learn BioTouch and to use it is just to do what we're going to do tonight, to learn those sets of points. And you do not have to learn the whole system. You can learn just what you really want to use to address a particular condition for someone. So everyone has access to BioTouch. Everyone is capable of learning it and practicing it, and everyone is effective as Paul is. The very first time that you do BioTouch with someone, you are going to be effective. So we don't need to know the anatomy per se. We have a particular language that's BioTouch that takes everyone to those places on every body. So it's a very, very, we say it's here for everyone, and we really mean it. It's very accessible to us all, and we all have the ability in us to help and to care for another human being. That's what BioTouch really promotes. And bodies get better as well. The last bullet, BioTouch requires no special preparation, a belief, or a state of mind. So you do not have to prepare yourself or a space if you want to help someone with BioTouch. It can literally be used anywhere, anytime, with anyone. These are the tools that you carry around at all times. You don't have to have a particular belief system. BioTouch honors everything. Whatever your personal belief system is, it doesn't matter what the other person's is. You're going to be effective. It just cuts through all of that ego. We say BioTouch breaks down all of the barriers between us. All we're doing is honoring another human being in their pain or their stress or their suffering because we care. That's really what BioTouch is here to do. So, few simple little rules. We always like to wash our hands before you practice BioTouch with another person. Remember, it's one person touching another person lightly on the skin. We say like a butterfly. We're going to begin every session, whatever you do, with what the first set we're going to teach called the greeting. You're always using the first two fingers of each hand, lightly on the skin. And we're going to hold each set of points in those particular sets. We'll explain that as we go. You're going to hold those 6 to 8 seconds. Can be practiced anywhere. And there you have it. That's really basically it. Once you learn a particular set, you can just get to work. So this next page, terms used in this manual, these are usually used in our trainings, but we always like to bring your attention to the first 2 bullets. The associate. Remember I said this is a relationship of healing, 2 people involved. The associate is the person who is performing BioTouch, who is giving BioTouch. So we use the word associate because, as we say, it's a matter of convenience. But let's take a look at what the dictionary describes. Number 1, an associate is one often in the company with another, implying an intimacy or equality. Remember I said BioTouch has the power to break down all of our barriers. It brings us into an equality. That's what a true relationship is. And number 2, one having an interest in common with another. The other person in that relationship is called the recipient. This is the person that is receiving the benefits of BioTouch. And I just might say in that relationship, both receive benefits. This is a complete one touching another, but both the associate and the recipient receive and give the same. So Paul, before we go to the first set, the greeting, would you like to say something about the pages?
Yeah, we'll share as we're going to get to the greeting here, which we're showing on the screen. Each set of points has 2 pages. One is this little drawing that you can see, and it has numbers on it. Those will be the points that we teach. At the bottom of that page will be a synopsis of those points. And then you'll always see on each page where it says there, click to watch video. those will always take you to a link that's going to show you someone doing the points, why they verbally tell you where the points are, and those words will be the second page where it tells you exactly where those points are. So it's a great way to learn. You can go back and forth. The ebook version of this is awesome. You just put it on your computer or your tablet or whatever. So,
Yep, wonderful. Okay, so let's begin. As I said in the beginning, one of the things you're always going to do prior to addressing any other part of the body is called the greeting. This is something that is just 2 points, but it really opens the body and brings a harmony between the associate and the recipient. The one thing that will be reiterated in the video is that this is the only set that you will use one hand, and it will be your dominant hand for both points. So you can see that they will explain that in the video when we watch that right now.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay. The next set that we're going to share with you is the stress and anxiety. And if you recall, Dr. M mentioned stress is a very important part of, let's face it, if your body is under stress, it starts producing physical manifestations of your emotional or your mental stress. And so this is a really good one to use with IBS because your body is under stress. So as you'll see, very simple again, just two steps, 2 points on that body. And let's go ahead and watch the video.
And before we do that, if you'll notice on this chart, there's an X. Anytime we see an X on any of these charts, that's going to be a point that those 2 fingers stay stationary. We call that a hold point. And so when Bev said 2 points, that's number 1 and number 2, while that X always remains the same. And that's on all the different sets that we have. So,
yeah. Good point. Oh, pardon the pun.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
Okay. The next set is the head set, and this is a good one. Dr. M again was talking about depression. She was talking about the brain-gut link, the hormonal, the chemical balances, imbalances, sleeping issues, anything that can be related to the brain is you can address it using the headset. It's very, very important in, I think, all of this. So let's go ahead and look at the video.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead, where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge. Point 2 above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay. The next set is the metabolism. This is a really good one to use for so many reasons. One of them may be for that microbiome balance that Dr. M was talking about, because the metabolism set helps the body assimilate what it needs and eliminate what it does not. So it really is about the naturopathic, in her opinion, that whole body issue that comes up. So this is a really great set to use. Let's go ahead and watch the video.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay. So the next set we're going to share with you is the infection set. And if you recall, Dr. M talked about bacterial infections in the gut that sometimes can lead to certain issues, candida and things like that. This is a very, as you can see on the workbook, it shares with 2 other points, the allergy and the poison. But for our purposes tonight, we will show the infection point. So let's go ahead.
The infection, allergy, and poison sets are 3 separate sets of points. They all share the same hold point, which is the same as greeting point 1, located in the fleshy area just below the base of the breastbone. As with all sets of points, these may be touched repeatedly. Infections of any kind anywhere in the body may be addressed by holding X and with the other hand touching point 1, which is at the base of the large muscle on the right side of the neck and slightly above and behind metabolism point 1. Allergies or allergic reactions may be addressed by holding X and with the other hand touching point 2, which is on the right side of the neck, directly behind metabolism point 3 on the top of the large muscle. To address poisoning within the body, hold X and with the other hand alternately touch point 1 and point 2.
Okay, and the last set that we're going to teach tonight is, well, look at that, the lower abdomen set, because IBS is centered in that lower tract involving the colon. And so we want to address that with this set. It's very, very good to do that. So let's go ahead and watch that video.
The lower abdomen set may be used to address any conditions or organs which are located between the navel and the pubic bone. This might include conditions of the reproductive organs, the colon, the bladder, or hernias. When working on the lower abdomen, it is helpful to press firmly into the flesh. But while working firmly, be careful not to cause discomfort to the recipient. The lower abdomen has 3 steps. Step 1. Locate hole point X, which is on the pubic bone. Do not press firmly on this point. While holding X, touch points 1 through 5 with the other hand. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. Step 2. With the palm open and flat, slide the entire hand under the recipient's body and place the first 2 fingers of this hand in contact with point T on the sacrum triangle. Then with the other hand touch points 1 through 5 and X. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. And X, which is on the pubic bone. After completing this step, enhancements in local work may be performed wherever a recipient is experiencing difficulties of any kind. Step 3. In matching fire, touch points 1 and X, points 2 and 3, and points 4 and 5.
didn't have those on. So again, you just got a big time of nobody listening to anything. Just wanted to let you know you can do the points. You don't have to do all of them. If all you do is the lower abdomen, that's fine. If you want to just do the greeting, that's going to help. So, it's not, those are just all there for you to choose from. And again, you have about an inch to play with. It's not an exact science. So let your fingers feel where they should go, and they will always go to the right place.
Yep.
So now that I got the sound back on, thank you all for joining us for IBS, Irritable Bowel Syndrome. And thank you, Bev, for teaching. And again, if you have any questions, hey, contact us. We can Zoom with you. We can take you through it. We also have classes if you want to learn the whole technique. Also, you can join us Mondays with Bev and Paul, and we go more into detail about all these situations. So,
Yep.
Thank you all for joining us, and we'll
Thank you,
see
everyone.
you